Early diagnosis, helping the person to understand their illness, its symptoms, and treatment, and establishing a trusting relationship form the foundation for an effective treatment for bipolar disorder. Although medications form the cornerstone of treatment, helping people to learn coping strategies is equally important in providing much-needed mood stability for those with bipolar disorder.
Sometimes people live with symptoms. They really are like an anchor dragging and preventing you to living your normal life.
But I was diagnosed not until 1995, when I had already become a senior executive, a public affairs executive at international pharmaceutical company. My behavior was bizarre, to say the least, on the job. I don't think the company understood. I think they tried to put my behavior into some category that would fit for them. She's a personality thing or something that could work for them, but they never, ever addressed the fact that I might be ill. I was always type A in everyone's eyes. So a lot of my behavior, which was type A, I think in retrospect was probably part of the illness. And everybody sort of excused it because type A was what you had to be if you were a senior woman in a large company that was primarily male-dominated. So I kept having to prove to myself, I think, as well as to others, that I could do more and do it faster.
And there's some evidence now suggesting that every time the person experiences a manic or depressive episode, there may be perhaps changes in the brain structure. There may be changes in their cognitive functioning, things like memory, their decision-making skills may get affected with every new mood episode. And that's really one of the reasons we tend to encourage patients to get treated early, get diagnosed early, first of all, get treated early, and then stay on the treatment so that they can lead perfectly normal lives like anybody else.
Another important component to this is that it's important to emphasize education about the illness and adherence to treatments. The best treatments in the world are of no value if people do not believe that they're ill and do not believe that they need to take treatments.
You've always managed to get through life, and suddenly they're saying, you need to be on medication and this is what you have, and then you kind of wonder, like, okay, what does this mean? I don't really know anything about bipolar disorder. It's overwhelming. You don't know how to feel. You don't know what to think because essentially you have no education about it.
So it's very hard to accept, like when doctors tell you that you're not well, you don't see yourself. You must rely on your friends, your family, your doctor to give you an insight on what's happening to you.
It took me probably a year to accept it.
I was actually relieved to hear a diagnosis because I didn't know if what I was doing was really normal. It had become normal to me, my crazy behavior, but I, didn't know.
The main thing that tends to help is establishing a good relationship with the patient. Your patient needs to be able to trust that you're working in the best interest of the person. The other thing that we find very helpful is making decisions in a collaborative way. When the person is in crisis, even if it is few minutes, I think 5 minutes, it can make a world of difference to the trust that the patient might put on you in terms of the care that you're providing.
I really relate to him, and I think he does to me too, which he didn't at first either. But we've known each other now for, a couple of years. And I rely on my appointments with him. I trust him, and that's really important.
After someone is told they have bipolar disorder and they begin treatment, well, what I tell them in that instance is that you will get better. Almost all people get better. What I can't tell you is how much you're going to get better. It's pretty sure that you're going to have some improvement. Now, what the objective for treatment is to make this illness go away completely. And by that I mean no highs, no lows. So the mood state you're in, we want it to go away and we want it to never come back. But that's the objective for treatment. And if that isn't achieved, then we should keep on looking for medications.
It can take some time, from weeks to months, for the full value of treatment to become evident. Concerns about medication should be discussed with the healthcare professional. Sometimes it may take more treatment trials to find the right combination of treatments that work.
The course of the illness is very different from person to person. It's very difficult to predict when you start treatment whether or not the patient will respond. Some people are doing very well on a single drug, but that's only the minority of the bipolar patients. Patients, should be very well informed that when drug A is not working or psychological treatment A is not working, we can go to other drugs and we can go to combinations.
I was on every medication you could think of until we would find one that would work. And I don't know that that's unusual either, except I think a lot of people probably give up. And what I would say is you have to stick with it. And it's very difficult trying a new drug, casting aside another, but you have to stick with it.
It made an unbelievably large difference to her. It's almost like she was kind of being lost for decades, and suddenly she had something she could focus on and work with.
Since coming out of hospital and so on, medication has been very stable for me. I haven't had a lot of symptoms, and I haven't had any side effects.
Side effects are present in almost all medications. They run through a whole bunch of side effects. Well, you want to know, what are the most common side effects? And if I get them, what do I do? Do I call you? Do I hold the medication? These are things you need to learn about. And what I would say is that with every medicine, there's usually 1 or 2 or 3 side effects that are clinically relevant. So I would suggest you ask your doctor, what are the 3 most common side effects and how do I manage them? And then you'll be prepared to manage your illness.
Interestingly enough, research does not suggest that side effects are as important in adherence as issues such as acceptance and the quality of the therapeutic relationship.
Patients that experience this disorder often tend to believe, once their symptoms improve, that they're going to stay well for the rest of their lives, that they're not going to become depressed or manic again in the future. And unfortunately, that's not the case for something like 90 to 95% of people who experience a relapse of an episode within 5 years. So what physicians and the mental health care workers have to do is every visit the patient comes to see them, they need to spend at least a couple of minutes talking about the illness and the importance of staying on the medication and the strategies to cope with stress. The challenge is to stay on this medication for the rest of their life. We often say to people, let's look at 1 year at a time. Let's reevaluate at the end of 12 months and see what we need to do.